Okay. Good afternoon, ladies and gentlemen. Okay, welcome to room second for nursing. And my name is Denny. Today, I act as moderator. So without further ado, let's start our presentation. And for the first one, we would like to invite Ms. Chesa to start the presentation. Yeah.
Okay.
Oh, sorry.
Okay. Thank you. Thank you, Mas Denny. So shall I share my on screen?
Recording in progress.
Okay. Thank you.
You have 10 minutes to present your publication.
Okay. Thank you very much, Mas Denny. Good afternoon, everyone. My name is Chesa Septiana Pratiwi. I'm a lecturer of Faculty of Health Sciences from Universitas Aisyah Yogyakarta. And today I'm so excited to share our research on the significant impact of the COVID-19 pandemic on women's experiences during pregnancy, birth, and the postpartum period in Indonesia. This research is particularly important as it addresses the challenges faced by women during a critical phase of their lives amidst an unprecedented global health crisis. And before I start my presentation, I would like to share our gratitude to first for Professor Linda McGowan, who unfortunately unable to join today's conference because she is and also Dr. Andari Wuri Astuti as the principal investigator in Indonesia. And also I would like to send our gratitude to Ibu Dr. Vinami Yulian as one of our partner. This research was actually funded by the Global Health Research UK and collaborated between University of Leeds, Universitas Aisyah Yogyakarta, Universitas Muhammadiyah Surakarta, Universitas Gajah Mada, Edinburgh Napier University, University of Liverpool, and Ikatan Bidan Indonesia. This slide presents the overview of my presentation today, starting from the background, aim and objective, methods, result, key messages, and conclusion. The study has been published recently in 2023 at the BMC Pregnancy and Childbirth. So for those who are interested to read further of the more detail of our publication, so you can just you can just use this barcode and search for the research title. So in 2021, Indonesia witnessed COVID-19 becoming the leading cause of maternal mortality. The pandemic brought unique challenges to pregnant women, new mothers, and healthcare systems, especially in low and middle income countries, even though it happens not only in LMICs, but also happened in among the developed countries. And also, our study focused on understanding these challenges in the Indonesian context. So the aim and objective for our research was to capture the multifaceted impact of COVID-19 on women's experiences up to 6 weeks post-delivery. We had two core objectives. Firstly, to explore women's experiences across various settings, including primary health centers, hospitals, and both urban and rural areas. That's why we covered the 34 provinces from all over Indonesia, including West Papua, and both urban and rural areas. And secondly, to include women with diagnosed mental health conditions or those who self-identifying as experiencing psychological distress during and after pregnancy. We conducted a cross-sectional online survey using SurveyMonkey platform, and our respondents included pregnant women, those who had recently given birth, and postpartum women, covering all stages of pregnancy and up to 6 weeks post-delivery. We also obtained ethical approval from relevant institutions. So not only from the Ethics Committee of Universitas Asia Yogyakarta, but we also secured the ethics approval from the School of Healthcare Research Ethics Committee from the University of Leeds. We also collaborated with the Indonesian Midwife Association, the Central Board, and Mother Hope Indonesia to gather as many as participants as possible for the recruitment. And the data was analyzed using the descriptive statistic for the quantitative data and the thematic analysis for the qualitative finding. As for the result, so we successfully gathered full and completed data from 1,137 women. We found that 97% of the women had access antenatal care, but 84% of the women reported fear and anxiety about attending visits. And concerningly, 13% of the women were denied a birth companion, so they have labor and delivery alone by themselves without any partners or any family or relatives to accompany during the birth process, the delivery. And 28% had their babies removed at birth, separated at birth due to COVID-19 protocols. Anxiety was common, reported by the 62% of women, while 9% of women experiencing depression. So the key message is the pandemic added increased physical, psychological, spiritual, financial burdens during the perinatal period. So the finding included 3 big themes, which conclude the women's experience of the pregnancy journey. The first theme describe about the women's experience of the pregnancy journey. The second theme explore the narrative from the women about the preparing for birth, and also the relations as the third themes. For the example, this is the theme, the quotation from each theme. For example, like the theme 1, the women's experience during the COVID-19. So the participant mentioned that, as I am postpartum depression survivor in the previous childbirth, therefore in this pandemic situation, I feel more anxious than usual, with some describing suicidal ideation. I live at home alone. My first child is taken by my husband to work as a motorcycle taxi driver or as a Gojek or Grab driver. I always think about ending my life. So this is actually one of the quotations cited from the women who have the suicidal ideation. And the second theme, preparing for birth, the example for quotation mentioned that she is worried because the virus is everywhere, worried about the preparation for delivery. The women's parents cannot come to accompany the women in the delivery process. And she was thinking about the delivery procedure, what will happen with her first child when she gave birth while the father or her partner is working, and none will look after her first child. The sample of quotation which related to the relations, so the women described that she has less support since they were unable to have social meeting due to COVID-19 pandemic situation. She felt lonely. She felt safe only during the home confinement or during the social lockdown. But yeah, she felt lonely, by the way. Another key message that can be withdrawn from the finding was the disrupted of health systems because of COVID-19 pandemic. it affects services delivery at various levels, and notably, younger women with higher education and those unemployed were more likely to report anxiety. Our findings also underlines that delays in accessing health facilities and disrupted social support networks due to lockdowns exacerbated these challenges and widening health and social inequalities. And for the conclusion, so in conclusion, COVID-19 significantly impacted maternity services and maternity experiences in Indonesia, heightening anxiety, reducing social support, and disrupting maternity care services. This underscores the need for strengthening maternity services and responsive mental health support for women. It also highlights the importance of preparing healthcare workers and systems for future pandemic. As now we already heard about the mysterious pneumonia happened in China, and a system for future pandemic will be better to support women and families during the critical times. And as for the closing remarks, so I would like to share our acknowledgement to those, especially for all the participants. So for all the survey respondents, we're really grateful for them to fill our survey, and to Global Challenges Research Fund, United Kingdom, for midwives and nurses from 34 provinces who helped to reach the respondents and share the survey to their clients, and to Indonesian Midwife Association and Mother Hope Indonesia. And thank you very much. Thank you for your attention. And this research not only sheds the light on the immediate impacts on the pandemic, but also provides valuable insight for future healthcare planning and policy making in maternal and mental health care. Thank you very much. Over to you again, Mas Denny.
Okay, thank you very much for your presentation, Ms. Jasa Pratiwi. So if anyone in the room has the question, please ask. Okay, one question. Yes, one question. Yes.
And origin and explain Mexico, and then the location and site of the security of
Oh yes, Miss Vita. Okay.
Thank you, Mas Denny. Good afternoon, Bu Jessa. Thank you for your presentation. It was so insightful to us. But I want to know what's the follow-up action will you take for this mental health problem? We know that right now mental health problem is one of problem in Indonesia. Cases of maternal mental health so high in this year. So many cases happen. For example, baby blues and other. What your follow up about your research? Thank you.
All right. Thank you very much, Ibu Wita. So as for the follow-up, so besides doing another research, and we also have developed kind of modules that can be used for midwives. Especially we work very closely with Mother Hope Indonesia. So Mother Hope Indonesia is a non-government organization which focus on perinatal mental health literacy in Indonesia. And I'm actually one of the board member of Mother Hope Indonesia. And in the last 2 years, so after we finish our study in 2020 and then start to finish the writing and start to writing up the finding. So we also discuss any possibilities to develop kind of module. Therefore, in 2021 to 2022, we work closely with Yayasan Project Hope or under the funding from the Johnson & Johnson to develop a training module for midwives. And the module was actually implemented in several municipalities in Yogyakarta, for example, in Bantul, in Central Java, for example, in Klaten, and also in Bandung, especially in Bandung municipality. So we have already trained many midwives, I think more than hundreds of midwives, including Bidan Delima, who already have well prepared and very well understood about how to screen, about how to provide a psychoeducation, and the first help that can be used, or first management that can be undertaken if they happen to meet the women who show symptoms, any symptoms of perinatal mental health problems and disorder. And last time we also have a discussion with Muhammadiyah Disaster Management, MDMC, Muhammadiyah Disaster Management Center, to explore any possibilities to create kind of model for healthcare professionals preparedness towards the another pandemic or endemic, especially because Indonesia is very vulnerable to any kind of disaster, not only the natural disaster, but yeah, we know that currently the virus and everything also makes everyone get worried and anxious. So that is so far one or two of our next plan after we published our research. Thank you, Ibu Wita.
Thank you, Bu Jasa. About 2 years ago, when I'm in my master, my thesis is about mental health in maternal and post-maternal. I'm basically a mental health nurse, so your presentation so interesting me, and I hope for the future we can interact and maybe collaboration.
Yeah, sure. We open for any collaboration, ya, Ibu Finami, ya, because Ibu
Yeah.
Finami as one of the researcher and part of our team also join in this presentation, and especially because we under the Muhammadiyah and Aisyah, and we have so many resources as well to move forward. To move forward after this initial research. So I think we can start with maybe another meeting for collaboration. Thank you very much for reaching out, Ibu Wita.
Yeah, thank you, Bu Jasa.
Okay, thank you, Ibu Wita. So for the next presenter, we would like to invite Miss Alvia Nur Anissa. Okay, so you can start your Miss Alvia. Are you in here?
Yes, I'm here, sir.
Okay. Please, you can present your study, and you have 10 minutes. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. First of all, let me introduce myself. My name is Alvia Nur Anissa from Profession Nurse. So today I will explain the result of my research in the topic application of art therapy intervention on cognitive and psychomotor patient in controlling hallucination. Schizophrenia is psychotic disorder that can cause a person to have limitation in the process of thinking, communication, interpreting reality, feeling emotion, and expressing the emotion they feel. Symptoms that are usually experienced by schizophrenia suffer are disturbed in the thought process, psychomotor, cognitive, affective, and emotional, as well as experience secondary symptoms in the form of hallucination. Art therapy can reduce symptoms of hallucination because by carrying out art therapy intervention, it can minimize severe interaction with their own work, being able to signal thought, feeling, or emotion. purpose to determine the effective of cognitive and psychomotor art therapy in controlling hallucination. For the method, the research method used case study design with descriptive methods held in the Abimayu room at RSUD Dr. Arif Zainuddin Jakarta. The sample for this study of one patient with the inclusion criteria being patient with auditory hallucination and the cooperative. Based on the medical record of patient with unspecific diagnosis of schizophrenia, the variables consist of the independent variable, namely art therapy, and the dependent variable, namely cognitive and psychomotor. The instrument in this case study conducts a structured interview based on CK and SLI. The interview contained questions related to the respondents' hallucination. Then the application of art therapy intervention was carried out 3 times for 1 week in the Abimayu room at RSUD Dr. Arif Zainuddin Jakarta, and the intervention was carried out by researchers for 1 hour. For the result and discussion, on the first day of the intervention, the patient was given art therapy intervention doing waving use paper. On the second day, the patient was given a free painting intervention to express the patient feeling. On the third day, the patient was given an art therapy intervention making works of art to make headcraft and free painting to express the patient feeling. And the research in the component of cognitive assessment in the day 3 patient can able to name of content of hallucination, and patient is able to say when the hallucination is appear. The patient was able to say how many times the hallucination appear, and the patient are able to name feelings when hallucination occur. The patient is able to mention how the hallucination are distract. The patient is able to mention the use of the drug. Patient can explain how to control hallucination with zikir, and the patient is able to explain the importance of carrying out activity when hallucination appear. And this is for component psychomotor assessment. And the day 3 patient is able to demonstrate how to divert hallucination. Patients are able to apply distract method when their hallucination appear. Patients are able to use medication regularly according to the schedule. Patient can demonstrate how to manage hallucination by asking the nurse to have conversation. The patient is able to carry out scheduled activity when the hallucination appear to divert the hallucination. Based on the result of the case study, it showed that art therapy intervention is able to improve the patient cognitive and psychomotor skill in the controlling their hallucination. This is aligned with research by Andrea 2022, which explained that before the art therapy intervention was carried out, the patient was not able to recognize and control his hallucination. But after being given art therapy intervention for 3 meetings, the patient was able to recognize and control his hallucination. According to Rosita et al., this is because there was artistic activities such as carrying out the creative activity. Respondents are able to tell story and express the feeling. Can reduce anxiety, reduce feeling or anger, and improve the patient thinking and further improve motor skill. And the conclusion in this study, it was found that after being given art therapy, it was able to improve the cognitive and psychomotor skill of patient with hallucination. Because patients were able to recognize their hallucination, were able to name of consent of the hallucination, were able to divert their hallucination, and were able to carry out the scheduled activity independently after being given therapeutic intervention for 3 times. Within 1 week, the patient was able to control his hallucination independently. So this is my presentation. For the time, I will return to the moderator.
Okay, thank you very much for your presentation. Okay, anyone who will ask the question, please raise your hand. One question. Okay, so anyone who Okay, so if there is no question, we will continue to our next presentant. Okay. So the next presentant is Mr. Baidi Batiri, yeah, with the topic of COVID-19. Okay, the time and place is yours.
Okay, Assalamualaikum and
Waalaikumsalam.
afternoon for all the participants. Okay, I hope so that you all can hear me. Is it okay?
Yeah, we can hear you.
Okay, so we continue with our presentations. Okay, is it clear for all?
Okay. We can see.
Okay, so this is the beautiful from the north of Borneo. This is presented from the land below the wings. Yeah, this is Sabah. For those who are not being here, so this is the nice place for you all to visit. Okay, in Malaysia. So I will proceed with my study. Okay, the study will talk about the relationship between the level of knowledge of COVID-19 and the movement control order at the Kinaret Health Clinics, Sabah, Malaysia. Okay, just for introductions, by the end of the year 2019, the world was been shaking by the existence of the novel virus named as COVID-19. This catastrophic is frightens all over the world because it can cause mortality to others, especially for humans. Okay, and there is no way to stop COVID-19 during that times, only by enforcement of restrictors of movement control order to stop from separating the disease to the other countries. Okay, the issue is the communities of residents of Sabah still fare audit survey based retrieve which disturb the government's effort leads the increase of COVID-19 cases day to day. This is according to Nouri Shams and Abdulhamid. So Malaysian police commissioners also confirmed that there is increase in arrest statistic for disobey orders despite its fine 1,000 ringgit. It's still increasing even though it's been performed the fine to the officer to the those who are not obey to the movement control orders. Okay, and there are still numerous of Malaysians who do not comply with the instruction of the movement control order to stop the spread of COVID-19. This is due to the attitude or the low level of knowledge about the spread of COVID-19 disease and the movement control order, which is turn cause in disease quite difficult to restrain. So the objective of the study is to identify the level of knowledge about COVID-19. Secondly, to identify the level of knowledge of movement control order. And the number three is to identify is it there are relationships between the level of knowledge about COVID-19 and the movement control orders. And we have one null hypothesis here where there is no significant relationship between the level of knowledge about COVID-19 and movement control orders. This is a bit of literature review. According to Tedros 2020 and Jinping 2020, the COVID-19 pandemic is the least viral infections in the history of the world compared to some global disease. Okay, this also mentions by Sumaya 2018 and Jan 2019, the COVID-19 pandemic has now infected more than 64 million people worldwide and has claimed more than 1.34 million lives. Okay, Silla et al. 2020 state that global statement only by strengthening preventive and controlling for severe individual to individual infections and also within the countries. Only by controlling the movement we can stop the spreading of COVID-19. Furthermore, Muhyiddin 2020 and Ismail Sabri 2020 saying that the best approach to imposing control and preventions to measure by implementing of movement control orders. So at last, Nouri Sham 2020 and Abdul Hamid 2020, the colors attitude of some countries in measuring control the preventions is measured through the local and international travel restrictions such as air, sea, and by land. This is a few literature that can support the study during the research was conducted. This is the limitation. Some composition of the sample might be uneven. Limitation sample because of the movement control order. Limitation information about COVID-19 and movement control order might be lead to unexpected result. This is the locations of the study we conducted at the Klinik Kesehatan Kinarut within 10 kilometers of radius. The period is 1st April to the 5th May 2021. The study design is qualitative and cross-sectional designs. The population is 400. This is considering 25 to 30 patients every day who are staying in 10 kilometer radius from the Kinarut areas. Okay, then we're using the properly sampling, using the sample systematic sampling around 200. Okay, according to Kajik Morgans, this is considering about 12 to 15 sample every day except Friday because Friday is no clinic for cleanings only. Research instrument have we have three components. The component A is demographics, B is knowledge of COVID-19, and the component of C is knowledge of movement control orders. Okay, so be sure that we identify the eligible patients. Okay, and we are using the Google form to reduce the transmissions of the COVID-19. And before we are starting, we are sharing the links to the others. Okay, through the Google forms, and after that. We do the filtration and analyzing of the raw data. Okay, this is the demographic data. So, according to the study, okay, this is what we get. So, it's almost 50% of the gender, male and female. The age is around the 41 years old above is more, and the rest is below 30 years old. The education levels, primary school is the highest, okay, followed by the secondary school and the tertiary education, 31. Okay, and this is also additional information, okay, to strengthen the discussion later on. Okay, some areas with strong internet, okay, so most of the times, okay, 113 sample, they have a strong internet. Only 34 equal to 17% is the weak of internet access. This is analysis of the level of knowledge about COVID-19. Okay, according to the analysis, you can see that is 33.602. Okay, and the standard deviation is 5.45 is moderate levels. I mean, if you see the table number 2, that one is component inside how we manage, how we try to evaluate the level of knowledge by these three components, yeah, level of knowledge, sign and symptom, and controlling preventions. Okay, this is the level of knowledge of movement control order, also the moderate, okay, where the mean score is 3.430, the standard deviation is 5.524, is moderate level. So you can see that the level of knowledge about COVID-19 and the movement control order among the respondents is almost moderate. Okay, so the table number 4 is showing that the analysis of correlations, either is correlations within the level of knowledge of COVID-19 and the movement control order. So if you see from the previous correlations, there is 0.75, means very high correlations, whereas the finding of significant value is less than 0.05. So the analysis showing that there is a strong correlations between the level of knowledge of COVID-19 and the movement control order. Again, so hypothesis one, there is no significant correlation between the level of knowledge and the MCO. Okay, so there is a relationship between the level of knowledge and the MCO, where we get the correlation value is 71, the p-value is less than 0.05. This is very strong correlation. So we reject the hypothesis now, mention that there is no significant relationship between the level of knowledge and the movement control order. Okay, we go to the discussions. This is a bit, this is discussion about the knowledge of COVID-19. 91.4% of respondents said they have heard the health promotion through the sharing with their friends, the local health organization, as well as international organization that provide information and general knowledge about COVID-19. Okay, so why the level of knowledge is moderate? Okay, some of them might go through the informations, but some of them might don't get the fully information from the government also. So Ministry of Health Malaysia promoting healthcare they will make high level of knowledge about the signs and symptoms of COVID-19, even though we try to make a lot of promotions to bring up the awareness of COVID-19. Yeah. The respondent become aware and rejecting practice and attitude carelessly and less sensitive to the COVID-19 disease control and preventions. This is according to Hisham and Hamid. Yeah?
Okay, I'm sorry, Mr. But your time has up. Yeah, you only 10
okay,
10 minutes for presentation.
Okay. Okay, so I will finish by according to the all finding of the study is a correlations between the level of knowledge and COVID-19, where the level of knowledge COVID-19 is moderate and the level of knowledge of movement control order also in the moderate levels. By then, sorry, take a lot of times. Okay, so I send back to moderator. Thank you for enjoying for listening me. Thank you, moderator. Back to you.
Thank you very much, Mr. Baiti. Okay, if anyone has question? Okay, so if there is no question, we will move on to the next presenter. So the next presenter is Mr. Mesa Mahendra. Yes, the time and place is yours. You only
Yes,
have
here.
10 minutes to present your result. Okay, thank you.
Sorry, for presented is can in my only because Mr. Baiti maybe I can start share my PowerPoint. Okay, thank you. Wait. Okay, sorry, my document not support for this meeting.
Mr. Mahendra, you can you send your file to chat and we will help you to present?
Okay,
Can you send? Yeah.
I can share in here.
Can you send? Can you send the file in here?
I share about WhatsApp
Yeah.
in
What's up?
kemahasiswaan.
Oh, WhatsApp saya.
Oh, okay. Mas Fahmi, can you help me, please? Okay, present. Okay, I will help you to present. Yeah.
Yes. Okay. Thank you about Mr. Denny for start my PowerPoint. Okay, let's. My name is Mesa Mahendra. I come from University Muhammadiyah Surakarta. I can explain about my article, the relationship between family support and the independence of the elderly in fulfilling daily living activities. Okay, next. My supervisor is Abimulisin. Okay, increasing population life expectancy can result in an increase in the number of elderly people from year to year. This increased number elderly people can result in various health problems such as degenerative uh, and cancer, which because decreased productivities in the elderly to decrease in body function. In according to World Health previous sorry. According to the World Health Organization, in South Asia region, in elderly population is 19 around to 104 40 million people. In Indonesia is 80 million. Ministry of Health 2021 and Sukoharjo Regency in 2021 with the number of elderly as many as 113 to 86 people. Okay, next. The increasing next. Okay, the increasing number of elderly people will raise problem for the elderly families and society. One of the problem that arise in increasing ratio of elderly dependence where the elderly experience aging process from health condition to weak vulnerable due to reduction of more psychological resolve and increased vulnerability to disease so physical, mental, and social change occur which affect the level of independence of the elderly in daily living activities. In Makam Haji village, many elderly people suffer from disease disease such hypertension, anemia, cholesterol, etc. Preliminary studies conducted by research in 6 December in Makam Haji Village, Kartasura district. Okay, for of the 6 elderly, 5 elderly people can do daily activity independently, while one other elderly person said they still need help from others to walk, dress, and go to toilet. For elderly, in 40% receive sufficient support. Of the 4 elderly to elderly people were carry out activity. This line to lack of attention and motivation from the family because the family was busy with work activity outside the home. Okay, this type my region is Kartasura Health Center, a working area in Makam Haji Village. I start research in 20 August 2023 until 6 25 October. In this type of research in quantitative results using uh, analytical research designed with a cross-sectional approach. Okay, in totaling respondent, it 64 respondent. The sample was selected using purposive sampling technique, namely the research sets specific in criteria in accordance with the research objective. The conclusion criteria are elderly people who live with their family, elderly people who are willing to be respondent in age 60 years and over the respondent who are more than 45 years old. Okay, variable measurement, I using a questionnaire take from Sitanggang, a research questionnaire which had conducted validity and reliability tests on 20 respondents. And the questionnaire consists of 20 questions from 4 components, namely emotional support and 5 information support and 5 instrumental support and appraise support. And the variable of elderly independence in fulfilling the daily living activities is measured using a questionnaire
Windows lah
uh,
game aku bingung sih.
Cartel index measuring instrument consist of 15 questions. Next.
Okay.
Okay. The variable. Okay. The variable of elderly dependence in fulfilling daily activities is measured using bivariate analysis. In this study was the Spearman statistical test because the data were not normally. Okay, the result of the study
You have 4 minutes again,
consists
yes.
of responding characteristic including age and gender. In the table 1, based on this table, it can be seen out of 60 respondents, 15 and until 19 years old, and the lowest number is at 45 and until 60 years, and as many as 6 respondents. The gender majority is female, as many as 60 people, and male respondent as many 33 respondent. The family has in the majority of self-employed jobs as many as 50 people. Okay, the table 2 shows that out of 60 respondents, the lowest family support score 20 and the highest was 75. The average score 52.72. This shows that the elderly family support is moderate. In the activity daily living variable, those score in 21, and the hygiene is 65 with the average of 66.99. This shows that the average elderly person has a moderate dependent activity daily living. Next. Okay. From the result of the data normality tests are shown in table 3 with a p-value of more than 0.05 on both variable, both family support and activity daily living. So the preferred test was analyzed with the Spearman ring test. Based on the result of the Spearman correlation test analysis in the table 4, it shows that there is a significant correlation between family support variable and daily living activities with a significant value. Okay, P 0.001, P more than 0.0005 as a positive correlation. Judging from the characteristic of the respondent of the where are age for of 55 until 65 years. Next. Okay, sorry. Judging from the characteristic in age of 55 until 60 years. In theory, increased age will cause a decrease in body function, both physically and physiologically, so that it affects the ability of the elderly to perform daily living activities. In addition, the majority of respondents were female. This in
Okay, sorry,
Sorry.
but your time is up. Okay, you can maybe you can conclude your presentation, Mr. Mahendra.
Okay.
We will go to the last slide, and you can conclude. Can we go to the last slide of your
Yes,
presentation?
yes,
Okay.
in the last slide. Okay, the result of this study are support by several summary study include is relationship between family support and the independent of the elderly fulfilling daily living. Okay, thank you.
Thank you very much, Mr. Mahendra. And we will, because the time is up, we
Yes,
will
sir.
move to the next presentation. Okay, we will move on to Miss Sarina and Mr. Musa, Mas Dinda Musa, Miss Sarina and Miss Sarina Abdul Kasim and Mr. Mas Linda Musa. So the time and place is yours.
Hi, thanks for the introduction, Mr. Moderator. So let me just continue with my presentation.
Okay, you have 10 minutes.
Sure. Can you see my screen? Can you see my slide?
Yes.
Okay.
Yes.
Hi. Good afternoon. Assalamualaikum, everyone. My name is Sharina. I will be presenting, more like a set sharing the topic on the relationship between knowledge and attitude towards the awareness of the thalassemia screening among public university students in Sabah. So as an introduction, thalassemia is a congenital disorder of blood caused by the absence or reduction of one or more of the globin change in the RBCs or red blood cell. It is most common genetic disorder in the world, affecting approximately 250 million people, or about 4.5% of the world's population. So in Malaysia, it is estimated about 1 in 5 about 5% of Malaysians are the carriers, with the majority having alpha or beta thalassemia. This is from the Malaysia Thalassemia Registry in 2018. So the background of the study is that thalassemia affect the red blood cells of the body, most likely affected people from Southeast Asia, the Mediterranean, and the Middle East. This is according to the Rosami in 2017. And it is also the commonest inherited blood disorder in Malaysia in 2010, and witnessed 4,768 patients are registered as the thalassemia patient. This is according to Portal My Health 2017. Now, the beauty of the study is that Sabah recorded the highest number of thalassemia patients in Malaysia. It's like one Malaysian, one is having thalassemia in 13 Malaysia, with high percentage among Kadazan Dusun, which represent the largest ethnicity in Sabah. So this is still happening. Sabah recorded the highest number of patients with thalassemia in Malaysia. So the problem statement, the screening and counseling started at the primary care level, has been initiated actually since 2005 among teenagers in secondary school. Somehow rather, the number of new cases of thalassemia still happen. So with that, this has led to the study with the objective to explore the relationship of knowledge and attitude towards thalassemia among students that represent adult at the young age in University Malaysia Sabah or UMS with their awareness to thalassemia screening. Just a thalassemia knowledge review. Matt in 2020 discovered that the parental knowledge of thalassemia and its preventive measure was inadequate, whereas Gaffur et al. At 2016 found that 60% of parents had limited knowledge about thalassemia in their children, and Huck discovered that students on medical campuses have a high level of knowledge about thalassemia, which they attribute to the nature of the participants' field of study, whereas Shazad found that the prevalence of disease is higher in rural areas and indicate a lack of education, awareness about the disease and its prevention. And Mogadam in 2013 revealed that male had less knowledge about thalassemia awareness than female. In relation to the knowledge and attitudes toward the premarital screening and treatment, number of studies have found that lack of knowledge and awareness is a contributing factor to the failure of the thalassemia screening. This is the study by Gu Wahid Rayani in per se. Whereas Wahid et al. Look into the reason why people in Maldives do not get tested for thalassemia prior to and after marriage is because participants were not aware of the test or were not fully aware of the consequences of the disease. And Farsi in 2014 stated that religion has played an important role in all the decisions made by parents of thalassemia child, regardless of whether they believe that the premarital screening is important or whether they are aware of the thalassemia patient require lifelong blood transfusion. Let me just skip this. Religious belief plays an important role in refusal to undergo prenatal diagnosis and termination of pregnancy. This is the study finding by Suka in 2015. And majority of married participants in Malaysia were opposed to the termination of pregnancy. And NIM 2013 discovered that religious restriction is the primary reason for their decision to terminate the pregnancy. And another study by Jaffrey in 2015, parents were most likely to be interested in termination of pregnancy for condition at the serious end of the continuum. So we can see the various response to the screening and the what happened to the baby once they know that the mother is carrying the thalassemia baby. And for that, let me share the methodology of the study. This is the cross-sectional quantitative study with convenient sampling, where the sampling was determined using the Rosov software, taking consideration 10% of the total population of the student in the university. So in the end, all the students who attended the Pusat Rawatan Warga, or we call it's a clinic for the student and kaki tangan of the university, was selected to be the place of study, and the data was collected throughout 1 month from March to April 2019. So in the end,
4 minutes
for
left.
that, all right, sure. Um, The data was collected to the web-based questionnaire. I'm using the Google form where the student have to scan the QR code, and it is the adapted questionnaire from the previous study with the 3 Likert question, which is in relation to measuring or evaluating the knowledge level and the attitude. They've been asking the questionnaire has asked with the 3 option with yes, no, and not sure option. Ethical consideration was granted for me to continue the study, and in the end, it was noted that 318 participants were recruited for the study, with majority of the participants were female with 224. In relation to the race and ethnicity of the participant, it was noted that Bumiputra Sabah scored the highest number, is the highest ethnicity found in the study, where 50% of the participant were the local Sabahan. And UMS University Malaysia Sabah has total of 10 faculty, and for that it has been clustered into 3 major background into science, art, and economy. And for that, science student from the science background is the highest number from the study, with 60% of the total population, which most of them are from the year 1 year of study. In relation to the family history of thalassemia, 53% of the participant are not doesn't have the family history of thalassemia, and 42% are not sure of the family status of thalassemia. And the result shows that most of the students know about the thalassemia, with overall respondent at score of knowledge of 40.1 scored from 10 knowledge related questions, and 73.6% were classified as having a high level of knowledge, with 26.4 have low knowledge regarding the thalassemia. In relation to the awareness of the attitude towards the termination of the pregnancy, it was majorly agreed by 62.3%, but no further comparison in relation to religious background. The researcher did not ask what is the religion of the participant, because taking consideration of the ethical advice of the study. In relation to the low level of knowledge and thalassemia of the screening, as demonstrated, while majority of the respondents have heard the thalassemia, some of them were unaware of the condition, and for that reason, this suggests that education program to raise awareness of the thalassemia should be targeted more at young adults in their premarital and early marital years. High level of knowledge can lead to a more positive attitude towards the prevention of thalassemia in this population. In relation to the knowledge about the thalassemia in screening, also MAT 2020 on the other hand included that multi-ethnic group from multiple Malaysian locations as well as younger age group. And the finding of this current study indicate that little progress has been made in the understanding of thalassemia in nearly 10 years since the program has started. So this raised the question whether existing education program on thalassemia are effective in increasing awareness of the disease among the general public.
Okay,
And
I'm sorry,
however,
but your time is up. Maybe you can go to the conclusion.
all right, it's okay. Let me just go to the conclusion. Somehow or other, where is my conclusion? Okay, so basically the study found that adequate understanding of thalassemia and constructive attitude about it, and further research should be continued to the other ethnic group, especially in Sabah, to ensure that those in rural and urban areas receive equal care, enhance educational and programs about thalassemia towards the Malaysian goal that no babies born with thalassemia beta major by 2030. So
Yeah.
that's all. Thank you very much. Thanks for
Thank you very
listening.
much. Yeah, thank you very much, Miss Ha. If you anyone in here have a question, please ask one question. Please raise your hand if you have any question. If there is not, okay. Thank you very much for your presentation, Miss
Alright, thank you very much.
Yes. Okay, we will continue to the next presentation, Miss Nabila Shifa Atalia. Thank you, Miss Sarina. You can end.
Okay, thank you for the opportunity. I'm sorry for I joined with double account because I have trouble with my mic.
Okay, yes. Can you share your presentation? You have 10 minutes from now.
Okay, thank you. Okay, first of all, I am Nabila Shifatalia. At this time, I will give presentation about literature review, physical exercise for postpartum mothers as an effort to improve the quality of life after childbirth. Okay, for the background, maternal death is a big problem because it has an impact on the survival of the baby. WHO estimates that every day around 800 women die due to the problems arising during pregnancy and birth process. Approximately 80% of maternal deaths are caused by increased complication during pregnancy, childbirth, and the postpartum period. The postpartum period is marked by several physical and mental health problems. The most common problems are urinary and fecal incontinence, infections, sexual problems, breast problems, anemia, bone problems, headaches, back pain, constipation, hemorrhage, fatigue, depression, and anxiety. Other problems include difficulty sleeping, physical dysfunction, and unhappiness with partner support, all of which can negatively impact their quality of life. These problems usually occur in developing countries with lower middle incomes, where Indonesia was trapped in the category of developing countries with low middle incomes. In overcoming the problems faced by postpartum mothers, one intervention that can be applied is physical exercise therapy. Apart from overcoming physical problems in postpartum mothers, physical exercise can also reduce levels of depression so that it can improve the quality of life of postpartum mothers. In Indonesia, problems related to the quality of life of postpartum mothers are not given enough attention, so many mothers suffer from depression and have difficulty sleeping when taking care of their babies. Therefore, writing this journal aims to help increase public awareness regarding the importance of a good quality of life for postpartum mothers and provide input regarding things that can be done to overcome the problems of postpartum mothers. Okay, for the method of the research, I use a method literature review or systemic review that for the theme of literature is physical exercise therapy for postpartum mothers. For the inclusion-exclusion criteria is publication year from 2018 until 2023, English language articles for postpartum mothers research subjects, physical exercise intervention, free full text and randomized controlled trial research methods. And then for the keywords physical therapy postpartum with the PubMed database and the International Journal of Scientific Research. And then based on free full text types of research methods from journals and the title. And then there were 11 articles to be studied. This for the result of the research. I include some the journals, the types of physical exercise studied in this literature as stabilization exercise, aerobic exercise, Swiss ball exercise, and static exercise, as well as combined exercise between the pelvic floor muscles and breathing. For the first article or journal is effect of pelvic floor muscle exercise with breathing exercise in a phase of postpartum. For the intervention as pelvic floor muscle training with breathing exercise, and for the result is significant improvement in pelvic floor muscle strength and improved quality of life. For the second journal is the effect of a static exercise program versus Swiss ball training for core muscles of the lower back and pelvic region in patients with low back pain after child delivery. For the intervention as the static exercise program was compared with Swiss ball training for the core muscles of the lower back and pelvic area. For the results is both exercise used were equally effective in postpartum low back pain rehabilitation. For the third journals is effectiveness of aerobic gymnastic exercise on stress, fatigue, and sleep quality during postpartum. For the intervention as aerobic exercise. For the result is aerobic exercise significantly reduce stress, fatigue, depression in postpartum moment and improve sleep quality. Okay, for the next journal is the effect of stabilization exercise on pain, disability, and pelvic floor muscle function in postpartum lumbopelvic pain. For the intervention as stabilization exercise, for the result is stabilizing exercise can greatly reduce pain, disability, and pelvic floor muscle function in postpartum lumbopelvic pain. And the last,
1 minute left.
for the last journal, stabilization exercise affects function of transverse abdominis and pelvic floor muscle in women with postpartum lumbopelvic pain. Okay, next for the discussion. During the fourth trimester, many women experience musculoskeletal disorders, depression, difficulty sleeping, and other problems. The result of the intervention showed that physical exercise improved the mother's quality of life. And then several studies said that stabilization exercise can improve the quality of pelvic floor muscles and reduce pain levels. There is research that refutes the stabilization exercise are less effective in reducing postpartum pain and that other exercise programs are considered more effective. For next, as there is research that states that aerobic exercise is effective in reducing levels of depression, anxiety, fatigue, pain, and improving sleep quality. And then Swiss ball exercise and static exercise are effective in treating postpartum low back pain patients. And it was concluded that the combination of pelvic floor muscle training and breathing exercise showed an increase in pelvic floor muscle strength and quality of life. Okay, for the conclusion of the research is studies show that physical exercise, including stabilization exercise, aerobic exercise, Swiss ball exercise, and static exercise can help overcome problems in postpartum mothers. Although there is debate regarding the effectiveness of various types of exercise, the results of this research literature review indicate that physical exercise can improve the quality of life of postpartum mothers. Okay, for the limitation and nursing implication. For the limitation, as has been explained, the problems experienced by postpartum mothers have not yet received full attention. In Indonesia, there is still not many people raising the issue of quality of life for postpartum mothers, so there are difficulties in finding relevant journals and also difficulties in finding data related to postpartum mothers. And for the implication in overcoming problems that arise during the postpartum period, nurses can help provide education and act as counselors in determining the right type of exercise for the postpartum mothers. Apart from that, nurse can also gather postpartum mothers to do exercise together. It is hoped that if mothers meet other mothers, they will get encouragement because they are considered to have met people who are experiencing the same fate. Okay, thank you for the opportunity. I will return to the moderator.
Thank you, Miss Nabila Shifa, for the presentation. Anyone here want to ask? Please raise your hand. One question to Miss Nabila. Okay. One question you want to ask? Okay, if there is no one to ask, we will move on to the next presentant. Thank you very much for your presentation, Ms. Nabila. And we will move on to the next presentant with Ms. Vita Octaviana. The time and place is yours. You can start now. Okay, maybe oh, okay. Okay, if I I think because there is a little trouble with Miss Octavian, move on to the next presentant. Yeah, Miss Lia Kiki Mahmudi. Are you ready for the presentation? Miss Lia?
Minutes.
Okay.
Is there the slide have?
Yes, we can see your slides. Okay, please continue your presentation. The time is yours. 10 minutes.
Okay, thank you for Miss Denny. Before it, good evening, ladies and gentlemen. Let me introduce myself. My name is Legiti Mahmudi. So I come from Public Health Study Program, Faculty of Health Science, Universitas Muhammadiyah Surakarta. So today I would like to present my research under the title Heart Belief Model in Compliance with the use of personal protective equipment or among nurses at the Ichwb Hospital. So on this virtual international conference on health and well-being 2023. Okay, the introduction, according the complex data on the use of personal protective equipment at the hospital Ichwb February until June 2023 has not researched 100%, and even research from the adjustment based on the report on improving the quality of the patient statistics week, or we can say PMKP, not February until June 2023, Hospital X in Boyolali obtained data on the complete of the use of personal protective equipment like this picture. So, the theory of the health belief model contributing to the adopt of the personal protective equipment use behavior personal protective equipment in the hospital has been provided by several students from the journal as own year 2016 University site. The complete with the use of the personal protective equipment is not related to the health belief model variable. So the results show that the outside they're creating 73.500 percent of participants attract to the personal protective equipment used based on the perceived accessibility with the p-value 0.054. So the perceived benefit with the p-value 0.03, we are significant. So perceived severity with the p-value 0.14 is stated to be insignificant. So from the journal, Reza Maulana Siddiq, Yulius Sunaria, and Fitri Dewi Mentari in 2021, it is stated that there is a relationship with the variable perceived accessibility, perceived severity, perceived benefit. So the results show that the perceived accessibility with the p-value 0.002. So perceived severity with the p-value 0.00 and the perceived benefit your assessment with the p-value 0.00. So a review of reviewers research led to complex with the use of personal protective equipment still has a different in result, even though the result of a journal as own at the 2016 and Reza M 2021 all have a relationship. So the research, the method here, research design use was observational with a cross-sectional approach. So this research was conducted at Hospital X in Boyolali in September until October 2023. The population in this study was active nurse who provide service at the X Boyolali Hospital, which amount to 246 people. So the number of the sample in the study was 150 people. Taken using the Lemieux formula, the independent variable in the study is the health belief model, which consists of the perceived accessibility, perceived severity, perceived benefit, and perceived barrier. So, and perceived choose to action. So the dependent variable in this study was complex with the use of personal protective equipment in yours, which includes mask, glove, and gun. So the questionnaire has been the test for validity with R tabel 0.361 and the reliability testing use the cross alpha formula less than 0.60 or 0.944 less than 0.60 can decide to be a reliable questionnaire. So the data collection is carried out by the mean of the respondent failing in the stemless data analysis study using univariate analysis and bivariate analysis using this chi-square test. So this research ethic have been carried on this research and signal permission from the Health Research Ethic Committee, or we can say KEPK, Faculty of Medicine, University of Muhammadiyah Surakarta, with number 5036 RB, or KEPK FKUMS X1 2020. So here the result. The first is characteristics of respondent. The first table tell about frequency distributive of respondent, characteristic of gender, education level, like of service, and age.
You have 3 minutes left, okay?
Okay, so the based on the respondent characteristics table, it is known that the more gender is male as many as 107 people or 71.3%. The highest level of education, D3, is 103 people. The most working period is 1 until 10 years, which is 107 people. So the most as the 20 until 30 years, which is many 73 people or 48.7. So next is univariate analysis. The table 2 tell about frequency distributive based on the reset variable, namely complete with the use of personal protective in the nurse, perceived accessibility, perceived severity, perceived benefit, perceived barriers, and perceived choose to action. So based on the table 2 about the univariate analysis from 150 respondents where with the sample in the study, it was known that the variable of conflict with the use of personal protective in the nurse was the most respondent who had high complete as many 57 people in the variable of perceived accessibility. Most respondents who had a high perceived sustainability as many 72 people or 48.0%. In the variable of perceived severity, most respondents had a high perceived severity as many 73 people or 48.7%. In the variable of perceived benefit, which has a high perceived benefit of 61 people or 40.1%. In the variable perceived barrier, which has a high perceived barrier by 52 people or 34.7%. In the variable perceived choose to action, which has a high perceived choose to action by 59 people or 39.3%. So this is tell about bivariate analysis on table 3. This is based on the bivariate analysis table above. It is know that the perceived susceptibility variable after statistic tests show that the of 91 respondents who had low complete perceived susceptibility to belief with the use of personal protective in the news. There were 67 respondents who had not complete in the use of personal protective equipment and 26 respondents were high complete in using personal protective equipment. Meanwhile, of the 59 respondents who had complete with the PPI use or 26 respondents, we are non-complete in the use personal protective equipment and 33 respondents. We are complete in
Sorry, but your time is up. Maybe you can go to the result. Go to the result. Yes. The conclusion. The conclusion.
So the counseling is in the study is the variable that have a significant relationship with the conflict with the personal protective equipment use are perception of benefit and the perception of choose to action with the variable that do not have a significant relationship with the conflict with the personal protective equipment use are perceptive of susceptibility, perceptive of severity, and perceptive of barrier. Okay, that's thank you. That's I can tell about my research.
Okay, thank you very much, Miss Lia Kiki. Maybe if anyone want to ask to Miss Lia Kiki, yeah, you can ask. You can ask by raising your hand first. Okay. Anyone? I think the presentation is quite interesting. Okay, if there is no one to ask, Miss Vita Octaviana, are you ready for your presentation?
Okay.
Okay, your time is 10 minutes. You can start from now.
Thank you, Pak Jenny, for the opportunity. Today I will present my simple research about social skill training intervention in schizophrenia patient experiences in social isolation. As we know, right now, mental health is one of biggest problem in the world. One of the side effect of the schizophrenia is social isolation gitu ya. Nah, social isolation is a big problem in nursing that happen in patient with mental health. The increase indicated that patient need more communication ability to interact with others, and social skill training is one of the therapy that we use on this problem. Social skill training or SST is one of specialist nurse intervention that we do in our patient. After we do generalist intervention, we do social skill training as specialist intervention. The purpose of this study was to determine the effect of SST intervention on schizophrenia patient with isolation social. The method of this paper is use systematic literature review. We obtained by electronic search from 7 database on journal, EBSCO, Science Direct, ProQuest, Scopus, Sage Publication, Wiley Library, and Taylor and Friends. The inclusion criteria used were human subject in English and full text from 2040 to 2023. The article analyzed in the end, the article analyzed were 10 articles. And by the systematic review, we find that SST intervention had effect to improve social skill and activity daily living in schizophrenia patient. When I was in resident student 2 years ago, this SST we actually, when we meet a patient with isolation social, we use this intervention, and that show that SST have positive effect when we use in dialysis nursing social isolation. And when we search the by systematic review, the result is the same with the practice we do. So SST was recommended for us as a nursing to implement to our patient, and we hope that we can improve our detail in SST for the next collaboration with other other mental health professional. So this can be used in general for patient with social isolation. Okay, thank you, Pak Denny. That's a simple presentation.
That's very quick presentation and very good presentation. Okay, if anyone wants to ask, please. I think there is a plenty time left. We have still 4 minutes left. Okay, anyone who wants to ask? Okay. Okay, if there is none, okay, thank you very much for your presentation, Ms. Vita Octaviana, and we will move on to the next presentation. Ms. Chung Soo Chin, the time and place is yours.
Hi, good afternoon. I'm testing this share screen and I couldn't find where is the sharing the button.
Sharing the PowerPoint.
Yes.
Oh, you
There
cannot
is
share.
no. Oh, I got it already. Yes. All right.
Okay.
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 Can you see the slide?
Yes, we can see the
Yes, thank
slide.
you.
Okay. 10 minutes for the presentation.
Good afternoon to our dear moderator, Mr. Denny, and our reviewer, judges, and all the participants inside this breakout room. And my name is Tung Soo Ching. I'm very happy to join you all accepted me to do these oral presentations. And today, my topic of my study is relations of knowledge and practice among nursing students on acquisitions and retentions of cardiopulmonary resuscitation, CPR. Right, we'll start with the introductions. Right. The cardiac arrest is the sudden cessation of a person's cardiac activity and is often fatal if corrective measures is not taken. So prompt initiation of CPR is the most critical intervention that determines cardiac arrest survival. Hence, the AHA, American Heart Association, advocates the need for high CPR competency among healthcare providers And it is crucial that everyone know that, because an emergency can occur to anyone, anywhere, at any time, no matter who they are or where they are. So, however, the shortcoming of the current approach to teaching CPR, which often result in poor knowledge skills retentions among learners within weeks of commissions the CPR course. So the problem statement for this study is the student nurses' CPR performance are deemed inadequate in their knowledge and also incompetent in their skills of practice. Right, specific objective for this study is to determine the knowledge of nursing students on acquisitions and retentions of CPR, and to determine the practice of nursing students on acquisitions and retentions of CPR, and the third one, to determine the relationship between knowledge and practice of nursing students in the acquisitions and retentions of CPR. Okay, these are the 5 literature review. There is a meta-analysis has been done on this 5 literature review in order to determine the overall trends of the studies. And also for each individual study, we reporting that any measurements of to have any degree of errors in these studies. Right. Next, we move on the methodology. The study designs for this study is quantitative, using descriptive correlations, aim to empirically determine the CPR knowledge and practice on acquisition and retentions among nursing students. The study site is at the Faculty of Medicine and Health Sciences, UMS. The scope of the study is limited to second years and third years diploma nursing. And December, our populations for these two second year and third year diploma student is 92 students. But using Krejci and Morgan's 1970, the expected sample is 73 to 76, right? I'm using the purposive sampling, and the sample is number is 76, right? Who make the inclusion and exclusion criteria. About the ethical considerations, approval have been taken. Approved from the community ethical community. The approval code is JK Etika 2/22, okay, 2. And informed consent have been taken from the students through the online Google form. Okay. The research instruments is a self-rated online questionnaire which is formatted according to the 2020 AHA guidelines. And study have been done, and Chromebook alpha value is 0.839. And in these instruments, there are 3 sections. Section A is the demographic data, about 5 questions. Section B is the 10 single response questions focused on knowledge of basic parts of knowledge of 3 basic parts of the CPR: the airway management, rescue breathing, and the circulations. The section C is the 10-item checklist to assess if a nursing student can perform CPR according to BLS sequence of actions and AHA recommended guidelines. Okay, we move on to the data collections and data analysis. Okay, once we get the ethical approval from the committee, then the link for Google Online for the questionnaire about the knowledge part of the section A and B will be circulated to the students, and it will be done 1 day before the practice assessments. Okay, after the knowledge part settled, then we will move on to the conduct the assessments on the CPR practice. Okay, then we compile all the raw data in a Microsoft Excel spreadsheet, and the raw data will be imported to SPSS version 27 to get analyzed. Okay, these are the results. This is the section A about the demographic, which consists of the age, the gender, the year and semester, and also the experience in performing CPR on patients, and also whether the patient has experience in witnessing healthcare worker performing CPRs on patients. Next, we move on to the result on the level of CPR knowledge. The mean level of knowledge is 5.68, and the level is medium. Same like with the CPR practice, the level of practice is 6.05 means with the level of medium. So both the results reveal medium, and I use the UMS marking scales for the reference for the level of knowledge and practice. Next result is related to the correlation coefficients. Okay, the result revealed that there is a strong relationship between the variables of knowledge and practice, which is 0.884. The significance is 0.10. Okay. Right, we move on to the discussion part. So through the findings showed that the level of knowledge of nursing students regarding CPR was medium, which may be attributed to the program's teaching methods of lectures and task trainer. And this was supported with a few study. For example, the students on the experiment.
You have 3 minutes left.
Great. Student on the experimental group who received additional CPR scenarios with high fidelity, it showed that the students having a better score on the knowledge part, and also students with high fidelity group also having a better knowledge score. Okay. The next finding showed that students' CPR level of practice was medium, which may be attributed to the lack of practice or lack of opportunity to perform CPR. And I have shown here a few literature that support these discussions. Right. The third one is the findings show that there is a strong correlation between knowledge and practice among nursing students on acquisitions and retentions of CPR. And I have put here a few literature that support these discussions. Right, recommendations. Okay, number one, the provide CPR training tailored to the learners' needs and increase learner self-efficacy, which is it mentioned here, learning process based on individual needs can effectively improve learner self-efficacy and confidence, and most likely performing well in the event of cardiac arrest. And the second recommendation is to provide CPR training program that are effective in retraining knowledge and skills. Okay, whereby there are two literature here to support these recommendations. Nurses undergo periodic booster CPR training, okay, will have enhanced their knowledge skill retentions over time. And also a few literature supported the training and retraining method were able to retain more knowledge and skills on CPR. Right, these are the references. Okay, thank you very much.
Thank you very much for your presentation, Ms. Chung Soo Jin. Good. Okay, if there is anyone who want to ask, please raise your hand. For this presentation, Anyone? Okay. Okay, I think maybe there is no one who want to ask it, but thank you very much for your presentation, Ms.
Right,
Chung
thank you very
Soo Jin.
much.
Thank you. Okay, for the next one is Miss Nindya Aristia. Are you ready?
Yes.
Okay, the time is yours. You can start now.
Okay, wait.
Udah berarti tadi dikalikan aja ya presentasenya ya. Oh, terima kasih ya Pak ya.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Nidya Ristia. I will present my article entitled The Effectiveness of Use of Whole Finger and Hypnobreathing Technique in Reduced Pain Level in Women in the First Stage of Labor. First introduction. Childbirth is a psychological process that occurs in every pregnancy. Every time you give birth, a mother will experience pain that is different for each individual. The pain is caused by a significant increase in myometrial activity, so that contraction become regular. Almost all births are accompanied by excessive pain due to psychological factor, panic and stress in each mother. This is often called the fear tension pain concept, where fear will cause tension which can cause muscle to become stiff and
Miss
weak.
Nindya,
Yes.
we cannot see your presentation. Yeah, I think it's stuck. It's still stuck.
Okay, wait.
Maybe you can just click the enable editing and you can slideshow.
Okay. Okay. Uh, I'm slide. Can you see?
Yes. No, I'm sorry, we cannot see your
Okay, I
PowerPoint.
continue. Almost all birds are accompanied by excessive pain due to
No, no, we
psychological
cannot
factors.
see. No, we cannot see actually. Where's your presentation? Sorry. Or maybe you can share your PowerPoint and the admin will help you. Okay, yeah. Enable editing, yeah. And you can,
Okay, okay, sorry.
okay.
Yes. Almost all birds are accompanied by excessive pain due to psychological factor, panic and stress in each mother. Use of finger hold technique and hypnobirthing to help reduce the intensity of pain in mothers in the first stage of labor. One non-pharmacological method to reduce pain is to use finger grip technique and hypnobirthing. Non-pharmacological method aim to distract so as to prevent the brain from producing pain sensation. Next, purpose. The aim of writing this article is to determine the effectiveness of providing finger hold technique and hypnobirthing intervention in reducing the level of pain in mothers in the first stage of labor. Research methodology. This research uses a case study approach method by implementing finger grasping technique and hypnobirthing intervention, which aim to determine the positive effect in reducing pain in mothers in the first stage of labor. This type of research is quantitative. The instrument used in this research, namely the numeric rating scale, is used as a tool to measure the pain scale with a pain scale of 1 to 10. The sample is in this study is all mothers who gave birth in the maternity room at Padang Arang Hospital, Boyolali on June 5 to 11, 2023. Sample totaling is 6 people. The intervention was carried out for 10 to 15 minutes. Hypnobirthing on the pain level of mother in the first stage of labor. The research result will obtained for measuring the level of pain felt by the mother before and after being given the intervention, and then process
Yeah.
reproducibility
Excuse me.
test.
Your PowerPoint is not shown. It's in India. Sorry. Can you share again?
Next,
Okay, please
result
continue.
in this study. All pregnant women who were responding in this study had different characteristics. However, based on ethnic, all pregnant women who were given finger hold technique intervention and hypnobirthing come from Japanese tribe. Apart from that, the characteristic of pregnant women can be seen in the following distribution table. Table 1, this is distribution of respondent based on age in maternity room at Padang Arang Boyolali Hospital. Based on the table above, the results showed that the majority of respondents who received intervention were 20 to 26 years old, namely 3 people. Next, table 2, distribution of respondents based on the last education. Uh, Based on the table above, the highest level of education among respondents was high school, with 5 people. And table 3, distribution of respondents based on the number of pregnancy. Based on the table above, the number of respondents between primiparous and multiparous in balance with 3 people each. And then table 4, frequency distribution of pain measurement in mother in the first stage of labor before and after being given hold finger technique and hypnobreathing intervention in the maternity room at Pandan Arang Hospital, Boyolali.
4
Based on
minutes
the
again.
table,
4 minutes left. Okay, continue. India, you okay?
yes.
Yeah. Please continue. Please continue. Please continue.
Okay. This is table 4, frequency distribution of pain measurement in mother in the first stage labor before and after being given hold finger technique and hypnobirthing intervention in the maternity room at Padan Arang Hospital, Boyolali. Based on the table above, it can be seen that before being given the intervention, the highest pain scale felt by respondent was scale 8, and then after being given the intervention, the highest pain scale dropped to scale 6. The result of the Wilcoxon test show that the p-value is 0.020. Therefore, the hypothesis is accepted, which means that there is an influence of finger hold technique and hypnobirthing in reducing the level of pain in mother in the first stage of labor. This research is in line with research conducted by Alam, which state that the finger grip technique can reduce anxiety and the level of pain felt by mother giving birth. The finger hold relaxation technique is an easy way to manage emotion and develop emotional intelligence. This technique can help the body, mind, and soul to reach a relaxed state, wherein a relaxed state, the mother's muscle tension will decrease and pain can be reduced. Other research state that the finger grip technique is able to reduce physical and emotional tension and is able to provide stimulation to the brain so that the facilities energy pathway and reduce pain. There is the result of this research are also in line with research conducted by Prativi et al., which state that hypnobreathing is able to reduce the pain scale in mother in the first stage of labor. Hypnobreathing emphasizes the emergence of positive suggestion, feeling of calm, and relaxation that make you comfortable. When conditions are calm and relaxed, the brain will automatically release endorphin, which reduce pain and reduce anxiety and provide a feeling of comfort. However, if you feel panic, fear, or stress during childbirth, the brain will release substances that block the release of endorphins. The more afraid someone is during childbirth, the greater the pain they feel. However, hypnobirthing can make mothers relax and not panic so that the pain during childbirth is reduced and the birthing process goes smoothly. Next, conclusion. Based on the result of the analysis of this case study, it can be concluded that the use of finger grip technique and hypnobreathing is very effective in reduce the pain level of mothers in the first stage of labor. Therefore, it is hoped that health workers can apply this technique in the practice of health service for pregnant and giving birth mothers.
Okay,
Uh,
thank you very much for your presentation. The time is up. Okay.
Thank
Uh,
you.
Thank you. Okay. So, anyone who want to ask Miss Nindya one question on Miss Nindya? Okay, if there is no one, thank you very much for your presentation. So the next presentant is Miss Caroline Satu.
Yes, I'm Miss Caroline.
Okay, Yeah, I can hear your voice. But I
No,
cannot see your face.
wait, huh?
That's okay. Uh, okay, please
Yeah,
share
just
your.
right.
Okay, we can see your presentation. The time and place in yours.
Okay. Okay. Thank you, moderator, and then thank you all. And good afternoon, everyone. And then my presentation today is about stress associated with factor among nursing students in the is and I move this. Wait. Then the introduction is about prevalence of depression, anxiety, and then stress among adolescents and young adults is estimated to be anywhere between 5 to 70% worldwide. Then depression, anxiety, and stress are all thought to be highest in nursing student, and then this rate expected to remain high once the student graduate and become nurses. Can you see my slide? Stress has also and then it crucial to conduct a more comprehensive examination of the contextual stressors that are unique to the compassionate field of nursing in order to develop more effective support system and intervention. So the issue is stress has been linked to the severe alcohol, smoking, drug addiction in society. And student stress can be seen academically in their inability to complete assignment on time, their failure to submit assignment on time, their ability to solve problem, and then their grade deteriorating. And then excessive stress causes physical and of course mental health problem and then lower self-esteem. And then stress has been linked to interpersonal conflict, sleep disturbance, and then low academic and clinical performance. And then at the same time also the onset of the COVID-19 pandemic and the shift to an online learning format in the 2020 introduced additional stressor to the, especially to novice nursing student, and then concern about contracting COVID-19 or the well-being of the loved one become prominent, and then the move to virtual clinical was associated with academic stress and sense of isolation among many students, and then of course it provides significant contribution to the understanding of the complex and diverse mental health issue that nursing students encounter, and then specifically as they transition into the professional realm. Problem statement, of course, nursing students have been privileged to work with a wide range of issues that limit their abilities, then fear of failure, uncertainty about the future, anxiety, sadness, lack of confidence, depression, lethargy, poor sleep pattern, low performance, satisfaction, and then financial problem are common source of stress. And then, of course, the objective to identify the stress factor among nursing students in University Malaysia Sabah, and then specific objective, of course, to identify factor of stress among a student according to academic factor and interpersonal factor. This is the literature review support that stress was the most prevalent source of stress among King Sub-University College of Nursing students. Also supported by Polydor, academic are the most common source of stress. And then student nurse was have moderate stress, academic factor, which are student nurses load with research project, report, quiz, and examination by Lubrique 2013. And then nursing student experience stress for four source, academic, clinical rotation, personal problem, and then environment by Afzal. And then Hussein 2016, nursing student and clinical placement suffer from stress by Konza. And then interpersonal factor was the third most common stressor affecting student nurse. And then this study design, of course, cross-sectional study and a study preparation, year 1, year 2, and then year 3. The sampling design, of course, study design, of course, universal sampling, sample 152 total sampling, all nursing student we study population, and then study site, of course, in the Department of Nursing, Faculty of Medicine and Health Sciences at the University of Malaysia Sabah. And then ethical approval, so I get the ethical approval, and then informed consent. Then the instrument, of course, the self-report question A, consent of three part, demographic data, and then perceived stress, and then factor associated with stress among nursing students, and then collecting data, questionnaire distributed to all nursing students, and then complete the questionnaire within 1 week, and then data analysis will conduct using the SPSS version 25. And then this is the result. Then age, of course, the gender. Most of the gender female. And then year 1, year 2, year 3, and then single 96% single, and then 3% married. And then from this result, can conclude that perceived stress level among the student in study is moderate stress. And then according to the scoring, low is 12.5%, moderate at 83.6%, and the high is 3.9%. And then this is the result that show the student experience of reported significantly higher in academic factor, 24.9%, and then followed by interpersonal factor, 24.6%. And then from the academic factor, this you can see that inability to balance study, leisure time, less vacation, getting lower grade, and then burden with the study, inability to concentrate much higher compared to the others item.
3 minutes left.
To this result, there is a application of the academic factor towards the stress. Then interpersonal factors, of course, also contribute to the stress among the student. And then, of course, discussion nursing program are divided into theoretical and practical elements. Student will have less time for intracurricular activities and less time for break and relaxation, have poor time management, and then large number of academic tasks for stress. Also supported by the Evan and Kelly 2004, and then post curriculum reform have resulted in more rigorous and demanding classes, which has added to the stress created by academic factor by Gibbon. And then interpersonal factor, nursing as a discipline necessitated a rigorous curriculum in order to develop the necessary competency in each of students. So lack of cooperation for friends in a group, of course, can cause of stress. Then source of stress could be linked to the lack of social life as a result of living in the unfamiliar hostel, and then having a full activities, which prevents students from having a social life outside of the college and academic obligation. And then Mufida and Mona, interpersonal factors perceive source of stress by the student. And then according to the study finding, stress is more prevalent among nursing students. It is attributed to academic and interpersonal causes. Of course, the recommendation of course is advised to use proactive learning strategies, peer and staff mentoring and modeling, professional network, and then social support, psychology support, and then faculty role and behavior. Very important to help the student to overcome the stress. Okay, this is my reference. And then, okay, thank you.
Thank you very much, Miss Caroline, for your presentation. Okay, anyone want to ask Miss Caroline one question? Don't be shy. Okay. Okay. Okay, maybe they are too shy to ask. Okay, thank you very much for your presentation, Miss Caroline. Yeah. Okay. The last one is, I think, Miss Miss Octaviana again. Okay, the time and place is yours again. Thank you. Miss Caroline, can you end show your PowerPoint, Miss Caroline? I'm sorry.
No,
Okay.
this is my screen, Pak Denny.
Oh, okay. Oh, okay. Okay, thank you.
Yes, this is my second presentation of the day, right?
Yes.
Yeah. Okay, for the last presentation, I will present about the result of the effect of progressive muscle relaxation or PMR and tau stopping atau TS on hypertension client with anxiety during the COVID pandemic 19. And our team is me with Octaviana and Bu Mustika Sari and Bu Yosi Eka Putri. Okay, for the background, hypertension is one of physiological problem that continue to increase from year to year globally. Hypertension causes physical problem and psychological problem. As we know, the pandemic has caused many mental health problem, and with this research, we want to know how can PMR and TS decrease the anxiety on patient with hypertension, and we adapt towards stress adaptation theory. This research design used in quasi-experimental with control group mode, and this data was collected in Depok, Jawa Barat. The sampling data use total sampling technique with a sample of 62 respondents who were divided into two groups. One is group intervention and group two is group control. The group intervention is 30 client was given nursing therapy PMR only, and the group 2, 32 client were given generalist nursing PMR and TS or tau stopping. To measure the result, we use instrument HARS or Hamilton Anxiety Rating Scale to evaluate the symptom before and after intervention. We use univariate analysis, use frequency distribution and central tendency. Bivariate analysis use dependent t-test for the data with normal distribution, while for the data with abnormal distribution, we use Wilcoxon test. I want to jump to the conclusion that when we use only generalist nursing intervention, the symptom is more high than when we use combination of generalist, MR, and TS. So when we use more intervention to reduce anxiety, it shows that there's more impact to the anxiety level. So we recommend to nursing intervention to use intervention even the PMR or TS is one of specialist nursing intervention. It's okay, but we can collaborate to use this intervention to improve our skill, to improve our intervention to the patient. So at the end of this research, we hope that this research can be one of sources to improve nursing intervention. And this intervention very highly recommended if we use to reduce anxiety. Even right now it's not in pandemic time yet, but it will recommend to use every day, every time, and everywhere. Thank you, Pak Denny.
Okay. Thank you very much for your presentation, Miss Vita Octaviana. Okay, anyone want to ask Miss Vita Octaviana? There's still plenty of time, so you can ask. One question? No? Okay. Okay, if there is no one to ask, I'd like to announce that all of present in here, please stay in the room because Miss Dian will the jury will announce the best presentant. So I advise all of you to stay in the room, and the time and place is yours. Yes.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Dear all participants, thank you for your participate today for the presentation, and our presentation finished. Thank you for all your exciting presentation. After this event, after this, we will announce the best presenter for the presentation today. So all of you can move to the breakout room to nursing room 1. So there we have 12 presenter also for nursing track like that. So we will move to the nursing room 1. Please, you can move to the nursing 1. Thank you. Have a nice day. Thank you for today, for all your cooperation.
Thank you very much. Thank you. Move to
Is there any difficulties to move the nursing room 1?
Yeah, I do not know how to move to room 1.
Okay, in the bottom of the
Breakout room.
screen, there is breakout rooms.
Then click on
You
our name.
breakout room, and you can click that breakout room. After that, choose breakout room.
Or choose.
Yes, choose breakout room, and we will choose the nursing room 1.
Choose nursing room 1.
Yes.
I just saw only names, but I don't know how to go.
Oke, udah.
Hmm.